There's a new study showing that young adults who get HIV treatments are living longer.
News 3 This Morning reporter Eden Shekel joins us live from the AIDS Resource Center of Wisconsin in Madison with more on what they're seeing in this research and whether it's true here in this area. Good morning, Eden.
Hi, Adam and Danica. Good morning. So this study is showing improvements in treatment are helping. Now, newer drugs have less side effects, and they're allowing people with HIV to live near normal lives. Now, experts say this study represents what we're seeing here in Wisconsin, which is the only state in the country that has an HIV specialty home like the AIDS Resource Center of Wisconsin. It's basically a one-stop shop where patients can get health care, medical care, or dental care. While this study highlights the medical improvements made for people with HIV, experts say there are still social challenges that exist from living with this disease.
Make no mistake, though, stigma, discrimination, those barriers still exist. People with HIV are still afraid of disclosing their HIV status for fear that an employer might terminate their employment because of their HIV status.
HIV treatment can cost up to $2,000 a month, and that's just for medication. It doesn't include lab tests or a doctor's visit. Treatment is generally covered by insurance under the Affordable Care Act. Now, ARCW is concerned that people who need treatment may not receive it under President Trump's health care plan. Here in Wisconsin, about 250 people are diagnosed with HIV every year, but the spokesperson for the AIDS Resource Center of Wisconsin tells me that this is an all-time low, and he credits the efforts of treatment and prevention. Back to you.
All right, Eden Shekel reporting live from Madison. Thank you so much, Eden.